Gauri, you can begin. We are live.
Okay. Good afternoon, everyone. My name is Dr. Gauri Chaitanya, and I am a sports scientist in Abhinav Bindra Foundation. Today, mainly, I'm going to talk about female athlete triad. And the main idea behind this is to spread awareness to young athletes, female athletes about this condition because many of them suffer this, but they are not aware about it and they don't know whom to reach out, even if they know that they are going through something. So this seminar is mainly to give some knowledge and information about what is female athlete triad exactly. Now this topic will be covered in two parts. Part one will be introduction and two components of the triad that will be covered by me. And the second part will be covered by Dr. Anisha. Okay, so, okay. So what is exactly female athlete triad? Now this word female athlete triad was first introduced in 1970 and it mainly consists of three components, that is menstrual health, bone health and energy available. Okay, so now in energy available, so when you actually suffer female athlete or if you have the triad, what exactly happens is that there is energy deficiency, then the athlete might be suffering from certain menstrual disturbances, and also the bone health has been deteriorated, that is it can be anything osteopenia or osteoporosis. Now, why is it important to know this triad, or why is it important to know information of this condition? So let's talk about prevalence. Prevalence is exactly, it tells like in a particular number, how many percentage of athletes will suffer from this or are suffering from this. So as you can see that at a particular point of time, all the three conditions are present simultaneously. So that means all the athlete will be suffering from all the three conditions of energy deficiency, menstrual disturbances, and osteoporosis at the same time. And the percentage of these athletes vary from 0% to 15.9%. So, which is like it means that not necessarily that everyone will have all the three conditions at the same time. Okay, now there athletes could be suffering only two conditions out of these. For example, one might be suffering from osteoporosis and energy deficiency, or other might be suffering from menstrual disturbances and osteoporosis. So athletes who suffer at least two of these conditions range from 2.7 to 27% out of 865 athletes. Next is that up to 16 to 60% of athletes suffer from one condition. So it's not necessary that if you have all the three conditions, then only it's that the person is suffering from a female athlete triad. But if either of the one is present, then it can eventually lead to eventually lead to other two. So you have to be aware about that. Now, in this also, you'll see that more commonly athletes suffer from amenorrhea, secondary amenorrhea. Now, what is amenorrhea? Amenorrhea is basically absence of periods. Primary amenorrhea is that the onset of the first period is only late. And secondary amenorrhea means that you are having your normal menstrual cycles, but then suddenly you don't have your cycle for almost 3 months. Then it is called as amenorrhea. So almost 60%, 1 to 60% of female athletes are suffering from this. After that, eating disorder. So eating disorder, up to 48% of female athletes are suffering from that. And then there is low bone mineral density, and up to 0 to 39.8, that is almost 40% of female athletes are suffering from low bone mineral density, and that could be osteopenia or osteoporosis. Now, this triad is mostly seen in athletes who are into lean sports than non-lean sports. So almost 4% more athletes suffer from female athlete triad who are into lean sports, for example, gymnastics, figure skating, and such sports. So which sport does this affect? So as I told you before, gymnastics, ballet dancing, or figure skating, or endurance sports, for that matter, any sports whose performance will depend on the leanness of the athlete, they are at risk of female athlete triad. And secondly, also, that so in today's world there's so much of competition, and also there are so much expectations by the society about how one should look. So there is a lot of importance that is given to body image and leanness and thinness, and mainly females or the girls are the ones who are targeted in this. So they are aware that okay, now I have to be fit, I have to be lean, but they don't understand that along with it your body health is also important. And because of that they tend to take some extreme measures, and they can land up having certain disorders. Now this is the new model. So female athlete triad doesn't only just include low energy available or osteoporosis or amenorrhea, but from a normal condition, how they lead up to this condition. So there are various stages that lie between this. So athlete is not so one day it's not that one day athlete has a good bone health and the next day suddenly it's osteoporosis. No, there are so many stages in between that. All these stages are included in this triad in this new model. So it is like insufficient dietary intake, which starts with insufficient dietary intake, then because of which the energy available in the body is low, and that will eventually lead to low energy availability or an eating disorder, which we will know later in slides more in detail. Then there is menstrual amenorrhea. So it starts with luteal phase defects, then there is oligoamenorrhea, and there is amenorrhea. And the last is that there is incomplete bone formation. Now that could be because of various reasons, because maybe lack of nutrition, lack of energy, or the technique of exercising, or too much exercise. All these things can lead to eventually low bone mineral density, and then the last stage is osteoporosis. Now, what are the signs of female athlete triad? Now, signs are very important, because how will you know that you're suffering from this? How will you know that your peer or your friend is going through this? So these are the signs that you look for. So first is weight loss, irregular periods, fatigue, means you tend to get tired very easily. And one of the reason for that could be excessive exercise or lack of enough nutrition. Then there is decreased concentration. You're not able to concentrate or focus on your practice or on your daily course. Then is fracture. Now, fracture is mainly an outcome when your bone density has reduced. So that could be osteopenia or osteoporosis. Overuse injuries. Overuse injuries are injuries that occur when you've been exercising for long period of time, but you are not getting proper recovery. So exercise is there, but there's no recovery of the muscle or the structure, and because of that, you will have overuse injuries. Then excessive hair loss. Excessive hair loss is mainly because you are not having food that is complete of diet, or that has all nutrients, vitamins that are necessary for your health. So that will eventually lead to excessive hair loss. Now, these are some signs that you can look out for to understand that, okay, so it doesn't have to be that, okay, this person is suffering from the triad if the signs are present, but they could be just a warning sign like, okay, this is happening. So we have to be careful that this doesn't lead to that. Next is manifestation of triad. So what exactly happens when you have the triad or when you are suffering from it? So like I spoke before, there is weight loss, absent or irregular menstrual cycle. So it doesn't have to be just absent, but you are getting irregular menstrual cycle. Then chronic fatigue, fracture, compulsive exercise. Compulsive exercise means the athlete or the child feels restless if they are not exercising, and they have to exercise continuously. Now, even if they are told that no, you need rest, you need to recover, they are not going to do that. They will keep exercising. Next is increased infections and illness. This is mainly because you are not giving your body good rest, you're not having healthy food, or the amount of food that you're having is not enough for your body. Decreased ability to recover from injuries, anxiety, depression. So this time not only has this medical and physiological problems, but it will also have psychological issues. So the athlete might be suffering from depression, they feel sad, they are not interested or excited about their daily course or exercises, they are feeling guilty, or so all these things, they are feeling like they are getting complex. All these things you will understand when you talk to the athlete, or through normal conversations only. Then nutrient deficits, esophagitis, and esophageal perforation with self-induced vomiting. So this is basically what happens is that in order to be lean, some people, what they do is, athletes, what they do is they will eat food and then they will induce self-vomiting, or they will vomit it out again. And because of this consistent behavior, eventually your esophagus will suffer from inflammation. Then there is constipation, changes in, so there are certain hormonal changes as well. Then there are increased cardiovascular risks, decreased resting metabolic rate, slowed growth. Also, athletic performance will eventually, get impaired because you are not recovered. Your body is not getting enough energy to cope up with what you have exercised earlier, and reduced muscle mass. Now, warning signs of the triad. So now there are various signs that will tell you that, okay, this person might be suffering or will eventually suffer from the triad. So they can be food related and non-food related. Food related are that they will frequently comment about weight loss. Like they'll say that I've gained so much weight, I need to, I need to reduce my weight, I'm eating so much. Or they will criticize others when they are eating a lot. Like, how can you eat that? And that has so much fat. How are you eating so much food? All these talks will understand that this person is, getting excessively obsessed with being lean through their talks only. So you have to be very careful about, when you're talking to someone, you should understand, you should grab those signs earlier only. They'll also refuse to eat with others, or what they will do is, even if they get the plate, they will offer it to everyone else so that they don't have to eat. So these are all food related warning signs. Now, non-food related warning signs are wearing baggy clothes. They tend to wear baggy clothes, just to hide, because they feel complex about their body. They feel that, okay, I'm not looking lean, I've gained weight. So to hide that, they'll wear baggy clothes. Or they'll, continuously keep exercising because nothing, like, it's not enough for them. They feel that if I don't exercise, I'll increase weight, I'll put on weight. Then there'll be stress fractures. They'll suffer from frequent fractures. They have a lot of self-critical behavior. I mean, they'll keep on, targeting themselves that I am eating so much, I am not exercising, I am not good at this. So all these negative thoughts will eventually, these are the initial signs that will make you understand that, okay, I have to, talk or make this person aware that what is exactly happening. I have to get help. So for that, these are the warning signs that you should be aware about. Next are the risk factors of female athlete triad syndrome. So what are the risk factors? So if social isolation, low self-esteem, family dysfunction, physical or sexual abuse, participation in sports with subjective judging. So if you are not feeling comfortable around your peers, or if you're not feeling comfortable around your family, or you've already been through a lot of trauma, or you have peers who constantly keep criticizing you. So these could be the risk factors that would eventually lead a person to stop eating or exercise too much, all these things. Next, now let's talk about the first component of the triad, that is energy availability. Now, what is energy availability? Which means that you carry on, you do your exercises, you do your daily course, and even after that, there is some amount of energy left to carry out your physiological function. So physiological functions means your breathing, heart beating, or your kidney function. All these things, your muscles for contraction, they need energy. So even after you're done exercising, there has to be some amount of energy that is for your own body, for your own physiological processes. Now, this is called as energy availability. Now, what is low energy availability? That you're exercising so much and you're not taking proper recovery, that there is no energy left to recover from that. So the low energy availability will lead to eating, may happen because of the eating disorder. So main culprit behind low energy is your eating disorders. So you will it starts with eating disorder because you are not having proper food intake. Then there will be nutritional deficits. Because of that, there will be low energy. Because of low energy, you will end up having menstrual dysfunction, or you will end up having bone problems. Now, eating disorders. So eating disorders will have various consequences that can be medical, it can be psychological, and it can be psychosocial. First is anorexia nervosa. Anorexia nervosa means you restrict eating food or you stop eating food. So even there could be various ways through which you do that. You don't eat with your family, you don't eat with your peers, so that, or even if you have food, you share it with everyone else. You don't keep anything for yourself. So all these are behaviors of not eating food, and this mainly happens because the athlete feels that I've put on some weight or I'm gaining weight, even though their weight is below the ideal weight that they should have. So this is one type of eating disorder. And the next type is bulimia nervosa. Now, bulimia nervosa is mainly, it is characterized by uncontrolled binging. Like once you start eating, it's very difficult for you to control the food. So that is called as uncontrolled binging. So what happens is that the athlete is not able to stop eating, so they eat, and then after that is done, they feel so guilty about it that there will be some self-induced vomiting, or they will take some laxatives and diuretics just to just because they've eaten so much food, and then they need to compensate for that. But or they will do excessive exercise. So these are all behaviors of bulimia and anorexia. Now, the same eating disorder in athletes is called as anorexia athletica. So, if an athlete is suffering from this disordered eating pattern, they have fear of gaining weight, even though they are underweight. And that is mainly because they feel for their sports, they have to be lean. If they don't look good, then they'll be judged by the society. And there are so many things, or they have so much pressures that they don't realize that they are actually making their body suffer. They are actually making themselves suffer because of this. Now, what happens is that mainly in athletes, they suffer through anorexia because the food that they are eating is not enough to recover their body, because they exercise so much. They exercise the intensity of the exercise is very high, even the frequency of exercise is high, but the food that they are eating or the input of the energy is not equal to the output of the energy. Now, how do you diagnose that someone is suffering from anorexia? So first is refusal to maintain weight within the normal range for height and age. So they feel that, like if you tell them that your weight should be 52, 53, depending on your height and age, they'll be like, no, that's a lot. I don't want that. I'm just going to maintain it below 40, 45 or like that. So that is one of the diagnostic feature. Second is they have a lot of fear that they will gain weight, or they'll be getting fat, and this you will understand through talks and through their behavior. So you have to observe all this very carefully in how they are behaving. Next is severe body image disturbance or denial of the seriousness of the current low body weight. So even if you tell them ki, your weight is not in a normal range, you have to eat properly, you have to, put on some, because that's not right for you, they are just going to deny it. They are not going to agree to that, and they will not even act on that. And last is absence of menstrual cycle for greater than 3 cycles in postmenarchal women. So this is something, so what happens is that even if the athlete knows that they have missed their period, they don't know whom to reach out to or whom do I tell it, or they might not even know that this is not normal, that if you have missed periods, it's not something normal. You need to seek help in this. So they should be made aware about this, and they should be also made comfortable that okay, fine, you can come to me with any issue and you will get the right guidance. They should be made comfortable that they can come to you and talk to you about all these problems. Next is diagnosis of bulimia. So recurrent inappropriate compensatory behavior to prevent weight gain. Okay, so what is happening is that you're eating, but you don't want to gain weight. So you come up with some behavior which is just in compensation, and it is not right. It is not normal. And you do this at least twice a week for 3 months, then you will get diagnosed as having bulimia. Okay, so like I told you, so this inappropriate behavior is self-induced vomiting or taking laxatives and diuretics or excessive exercises. Now, there are also certain individuals whom you cannot classify exactly into these two categories, and they are called as eating disorder not otherwise specified. Okay, so even they are going through the same thing, but they might not have all these features or behaviors, but eventually that might lead to this. Now, what would happen, okay, if you're suffering from this eating disorder? So there will be decreased lean body mass, depleted glycogen stores, which means that you are not going to, the athletes will not be able to generate enough power because they don't have enough muscle mass, and they do not have enough energy stores. Chronic fatigue, eventually because of this there will be fatigue. Micronutrient deficiencies, anemia, dehydration, erosion of tooth enamel. Erosion of tooth enamel means the teeth start becoming yellow. Then gastrointestinal disorders or electrolyte and acid-base imbalances. So there are going to be certain physiological imbalances which will eventually lead to bigger problems. And psychological problems such as anxiety, depression, or decreased self-esteem, that can also happen. So it is important to spread awareness about nutrition. So it is very important for repair of the muscle tissue, and it is also important to recover. So it is important to exercise. In order to exercise also, you need some energy that is going to come from your diet. Then it is after exercise, your muscle needs to repair, and if you have injury, that also you need energy to recover from that. Now, commonly what happens is that athletes or people will have half knowledge about certain diets, like let's say for intermittent fasting or all these things. So they'll read it somewhere on social media, or they'll take advice from someone else and then they'll do it. But in order to do that, there is a proper plan that you need to know. That doesn't happen. So either you are frequently fasting, or you're skipping some meals, or you're skipping out important uh, food groups that are important for you. Then so what happens is that if there is no like if there's you don't have enough energy, or if you're eliminating some important food groups from your diet, then that will lead to imbalances in protein, carbohydrate, and fats, which are basically fuel, or they provide you with energy in order to exercise and recover. So mainly what is protein will help you to build a muscle or a repair a muscle. Glycogen will give you or the carbohydrates will give immediate, they are like immediate source of energy when you start exercising. So each of them have a different role to play, and that is why everything, all these things are important. It is important to consume all of it. Now, in addition, there are micronutrients such as calcium, magnesium, vitamin D. They are important for bone. Then vitamin D is used for energy production. Then iron, folate, and B12 are important for hemoglobin synthesis and blood formation. Zinc, antioxidants, and iron are important to increase body's immunity. And if any one of these is missing, then obviously you are compromising your own health. Now let's talk about bone health. The lot of bone formation or acceleration happens in girls who age from between 11 to 14 years. Okay, and up to when a girl reaches 2 years of her age, almost 25% of the bone mass has grown. And by 18 years of age, all the girls will achieve up to 99% of their total bone mineral content. Okay, so now what are the factors that contribute to the bone strength? First is high impact physical activity. Exercises will increase your bone density. Secondly is exercise. Like I told, exercise can cause up to 5% gain in bone mineral density. So what happened during exercises, the stress or the force that travels through the bone will actually help to increase the density of the bone. It acts as a stimulation for bone growth. Then bone mineral content, bone mineral density, bone microarchitecture, and bone remodeling. So these are basically factors that contribute to the bone strength. Bone health and female athlete triad. Okay, so in female athlete triad, the component of bone can range from a normal bone health or optimum bone health to low bone mineral density and to eventually osteoporosis. So what is exactly osteoporosis? Osteoporosis is decrease in the bone density or inadequate bone formation that will result eventually in low bone mineral density. So in this, your bone becomes fragile. The texture also of the bone also changes. So here you can see in this image, the pores are present, but they are present quite densely, like they are densely packed, and the size of the pores is also less. However, in this picture, you can see the size of the pores is more, and even the density of the pores is less. So this is basically osteoporosis. So why does this happen? So mainly because of if you do not have proper intake of macronutrients such as amino acids and fatty acids, or minerals and vitamins such as calcium and vitamin D, then that will eventually hamper your bone health. Also, certain hormones are important, and they also have function to maintain bone health, like cortisol and leptin, and also estrogen. So vitamin D, how is vitamin D helpful? It will mainly help the body to absorb calcium from the food, okay. And as you can see here, this is the unit of vitamin D that is recommended for the particular years of that child. And certain resources of vitamin D are cheese, milk, yogurt, salmon, eggs, and normal sunlight. So you have to make sure that this is included in an athlete's diet. Now, calcium. So calcium is mainly absorbed by your bones, and it is important for building and maintaining strong bones. So even if you have calcium and if you lack vitamin D, there's because vitamin D helps in absorption of the calcium, you're still, it's not going to help you. You need both of them in the body to maintain good bone health. And then certain resources of calcium are soy milk, kale, broccoli, tofu, spinach, almonds, um, and orange juice. Now, estrogen. So this plays a role more importantly in athletes who are suffering from amenorrhea. What happens is that because of hormonal imbalance, the production of estrogen in the body reduces. Okay, and estrogen is very important for maintaining good bone mineral density, because it will influence the calcium absorption and thus help in bone formation and remodeling. So estrogen, calcium, and vitamin D play part in the process that will help improve bone health. So having these in the right amount is important. Now, what is the treatment for this? So it is not treatment from one perspective, but many people are involved in this, such as because you need a pharmacological treatment, nutritional treatment, psychological treatment, gynecological, and physiotherapy. So screening. Basically, what is involved in screening is certain series of questions, like what was, or you just ask athlete the question, or you observe and then will know. So what was eaten in past 24 hours, list of any forbidden foods, highest and lowest weight since monarch, happiness with current weight, ideal weight according to the patient, disordered eating practices, binging and purging, use of laxatives, diuretics, or diet pills. So, in diet history, the athlete may not come upfront and tell you all these, even though they might be binging or purging or taking laxatives. They might not open up to you very easily, but you should know how to make them comfortable. You should make them understand and aware that what could be the consequences of this, so that they understand that okay, yeah, fine, like there are certain things, if I don't do them right now, if I don't get right guidance right now, over the period of time, that is going to hamper my body, my performance as well. Then in exercise history, exercise pattern or training intensity for the sport, like how many hours per day, how many days per week, how you've been working, or what is the intensity, is it high, medium, low, and how frequently. Additional exercise outside of required training. So if you go to you go to the academy where you're getting trained, you get trained there, then you go again home and then train or exercise. So all these things you should know, that in a day how many hours of exercise is actually happening. Recovery, is the recovery proper? Recovery includes sleep, hydration and proper nutrition. Then history of previous fractures and history of overuse injuries. What are the complications of triad? So like I've mentioned before also, it will lead to stress fractures, damaged body's recovery process, recovery will get hampered, then reduced ability to build bone, or reduced ability to increase the strength of the bone, and also increase the strength of the muscles, or maintain the muscle mass. Now prevention. So what could be done to prevent this? So initially, I feel that the most important part here is awareness, to make athlete aware about these things, to make them comfortable, that okay, fine. I mean, even if you feel that you are not if you even if you feel that you're overweight, you don't have to take any drastic measures. We all are here to support you, to help you, or all these right guidance, and making them comfortable is very important. Other than this, you have to monitor the menstrual cycle by using calendar. This has to be done by the athlete, by parents, by coach. So all these things are done together. Consult a physician if you have an irregular menstrual cycle and recurrent injuries like stress fractures. Talk to a counselor if you are overly concerned about your body image. See a sports nutritionist to help you design a healthy diet that is specific to your sport. So, you don't have to take drastic measures. There are professionals who are there out there who will help you achieve your goal. You just have to approach them. Seek emotional support from coaches, guardians, and teammates. So, this is as an athlete. As a coach, remind athletes that eating is an important part of successful training and performance. Focus on healthy body image and not on weight. So this is very important. Now, sometimes someone of same height and same age, uh, who look similar in the build as well, but one might have more weight, one might have lower weight. Now, the weight is not just decided by the amount of the fat that is present, but there are so many other things. There is bone weight, there is muscle weight. All these things are taken into consideration. So it's not weight, but your health is more important. Support athletes through training and everyday life. Have available resources such as nutritionists, trainers, and counselors. Okay, thank you. Does anyone have any questions?
Thank you, Gauri. I don't think people have much questions.
Okay, fine then. I hope that this information was helpful for everyone out there, and I hope that after this, parents, athletes, and coaches will actually spread this awareness around as well and make sure that no one suffers through this. Thank you.